Good afternoon, everyone. Thank you so much for joining GHF's Georgians for Healthy Futures Facebook Live conversation around Mental Health Awareness Month and also the Asian American Pacific Islander Heritage Month. We want to host a conversation that kind of elevates Mental Health Awareness Month, that being May, and also really sharing resources and having a conversation about mental health within the Asian American Pacific Islander community. So thank you again for tuning in to GHS Facebook Live this afternoon. My name is Kanetta Atkins, and I am the organizing manager with Georgians for a Healthy Future. Georgians for a Healthy Future is a nonprofit, nonpartisan consumer health policy and advocacy organization. And we are also the voice for Georgia healthcare consumers as state leaders are making decisions that really affect the healthcare of all Georgians. So today's conversation really aims to acknowledge Mental Health Awareness Month, and also to hear from advocates who are doing the work to reduce stigma about mental health in Georgia. And also having a conversation that elevates the special enrollment period for American Indians and Alaska Natives, and how everyone can get access to mental health resources through enrolling in healthcare coverage through the marketplace. Elevating GHF's role in parity. How do we define parity, and what did our role look like in the Mental Health Parity Act here in Georgia, the bill that was passed this 2022 legislative session, and also providing mental health resources for the insured and uninsured Georgia consumers, and also what that looks like for the Asian American Pacific Islander community. So thank you again for joining. And before we get into today's conversation, I wanted to acknowledge and share condolences to those in the Buffalo community who are grieving from the racist massacre that occurred on May 14th, as well as the city of Uvalde, Texas, and all those who are grieving in the wake of yesterday's mass shooting that happened at Ross Elementary School. It can be incredibly challenging and exhausting to hear these stories as often as we do. And sometimes it can feel like we're living in a heightened state of anxiety, and it's even more imperative that we are taking care of our mental health as much as we can. And I hope that today's conversation and the resources that we share will be helpful for all of you who are watching. So today I am joined by Traylyn Cooley, Deanna Williams, Camila Gomez, and Tom Liu. Traylyn and Deanne are healthcare navigators for GHF, and they are here to elevate today's conversation around the special enrollment period and what that looks like for Georgians and how they can really take advantage of this special enrollment period going on. Deanne Williams is the Central Georgia Insurance Navigator for GHF, and she provides support around enrollment and outreach in specifically 10 counties surrounding the city of Macon. And Traylyn Cooley is our other health insurance navigator that's focused on Georgia's LGBTQIA+ community. And he also provides enrollment and outreach assistance, specifically in Georgia's LGBTQ+ communities. So I'm going to go ahead and get into the conversation, starting it off first with Traylyn. Traylyn, as a proud voice in the LGBTQIA+ community, why do we need to have more conversations about mental health, and why is this conversation so meaningful, and why does it matter?
Good question, and hello, Claire. Just let me start by saying, as you began the conversation with sending out condolences for the events that tragically occurred, it's clear that there are many things that people are sometimes dealing with mentally, and we need to ensure that we are really beginning to make resources available for people, but more importantly, just beginning to normalize the conversation around mental health. Why do we need to have conversations about mental health? Because your mental health is just as important as your physical health. We exercise, we go to the gym, or we watch the types of things we eat, or whatever it is that we do when we focus on our physical health. We also need to have just those we also need to have a focus on our mental health as well. And that helps us to be able to navigate through life, processing things and making sure that we are just as healthy mentally as we are physically. Sometimes, for some reason, we forget that mental health is just as important as our physical health. And we sometimes don't meet those needs, or we don't address those things when it comes to making sure that we're mentally capable of making great decisions and just having knowledge about those resources. So we need to have the conversation so we can normalize it and so people can begin to erase a lot of the stigma that is even associated with accessing those types of services.
Yeah. So that's actually really interesting that um, your response, normalizing the conversation and making sure that people have access to their mental health services, because it's just as important to care for your mental health as you're caring for any other part of your body. So my question for you is, what do we need to be paying attention to, or what do you think we need to be paying attention to, or the Georgia community needs to be paying attention to when it comes to mental health concerns within the LGBTQ plus community? And this is a two-part question. So what do we need to be paying attention to when it comes to mental health concerns in the LGBTQ plus community?
Well, we need to be paying attention to conversations. Are we having enough conversations around mental health, first of all? Are people getting the knowledge that they need in reference to the resources that are available for mental health services? We have to pay attention to the verbiage that we use when it comes to seeking mental health services. We have to get away from those stigmatizing words like crazy and um, helpless and things of that sort, because people associate a lot of times those words with seeking mental health services, and the stigma sometimes keeps people from accessing those services. So especially particular to this community, because there are so many stigmas already associated with the LGBTQ
Mm.
community. We have to we have to show that we're allies to all people, and that we want everyone to be as healthy mentally as they possibly can. So we need to start paying attention to when people are reaching out and when people are crying out and when they are saying that they need help and that they need assistance. We need to take those things seriously and do our best we can to connect them to any and all resources available to them.
Mhm. Yeah. So you mentioned, really paying attention um, to those who are crying out for help, and normalizing the conversation more, paying attention to your mental health just as much as you're paying attention to your other physical parts of your body. Are there any additional barriers that you feel like exist in access to care for the LGBTQ plus community?
Yeah, one of the biggest barriers is knowledge. There's a limited knowledge base of available resources sometimes that are advertised, and people don't know about those things. So that's one barrier to accessing the care, because you don't have knowledge about it. Another barrier is many people think that mental health services are inaccessible, or that's something that can't be covered under my insurance. So why do I even need to worry about those things? And believe it or not, it can be covered under your insurance. So just having the knowledge of how to access those services and what tools you have available to you to assist you through that journey. So removing the barrier of access and just knowledge of those services, also sort of destigmatizing removing stigmatizing conversation as it relates to accessing those services and
Mhm.
letting people know that it's okay. So normalizing the conversation and making sure that it's an everyday conversation that we're beginning to have around
Mhm.
these resources and this topic.
Yeah, that's good. Okay. And so, and you even said, really just trying to shift the language and using less abrasive words um, when you're having this conversation in the LGBTQ plus experience, and making sure that we are using person first language. Like if they are experiencing, anyone who's experiencing a mental health issue or mental health crisis, like remembering that, okay, you are not abnormal. You're having a mental health issue, and that's just something that we can have an open dialogue about, and you don't have
Right.
to feel any shame.
So let's get real with this conversation, okay? So one of the biggest barriers, a lot, especially with our community, and I say our because I am a vocal voice in the LGBT community, is respecting the culture. You have sometimes so many mental health providers who disregard people's pronouns.
Mhm.
Something as what you would consider to be simple is very big to someone. Regardless of how I appear to you, how I identify is very important. And for you to acknowledge that and even acknowledge my pronouns removes one barrier to me seeking services because now I know that you are at least sensitive to my requests, you are sensitive to my culture, and you're appearing to be an ally to me. So that's very, very important. So when you have individuals who are providing resources, having that cultural sensitivity that you need and that knowledge base in order to properly engage with the community is very key and it's very important. And I've run across so many providers who are still struggling with those types of things, which is interesting to me,
Yeah.
especially if you are in a professional role to provide certain mental health services. So we still have to understand what those cultural asks are within the community and be more respectful.
Yeah, that's good. Like, so if you are listening and you are a provider or you're tuning in and you're a provider, like really making yourself more culturally aware in how you identify with the person that is in need of services or how they identify. And, that can really remove one of the barriers to them being able to access to care because, they're able to show up as their full self if their provider acknowledges them as such. So I like that. And so to go back a little bit, one of the things that you mentioned is people not feeling like they can access mental health care because it's not in their health insurance plan, or it might be, too expensive or not as affordable. So I want to bring Dan into this part of the conversation, and how access to mental health coverage is parallel to overall health coverage, and what health insurance plans look like in regards to mental health coverage. So educating the community or educating Georgia consumers about mental health coverage is one of the 10 essential health benefits through the Affordable Care Act marketplace, right? So through the healthcare plans that folks can purchase through the marketplace. You all know much more about that than I do, so I'm going to let you speak to that. But essentially, mental health coverage is one of those 10 essential health benefits that every health insurance plan through the marketplace covers. So my question for you all, Traylon and Deanne, are pre-existing mental health conditions covered through those marketplace plans? So if somebody is wanting to purchase a plan from the marketplace, but they might have some existing mental health issues, then will those pre-existing conditions also be covered?
Go
Charlene,
ahead, Deanna.
I was about to say, if I
Yeah,
may.
yeah. She
Comes
explains
to-
it so well.
Thank you, Kanetta. So when it comes to pre-existing mental and behavioral health conditions, you can still receive treatment when you get a plan on the marketplace. And your coverage and the treatment for the health coverage that you need will start when your plan starts. They can't make you wait a certain period before that service begins. You will still get that treatment for the behavioral health or mental health service that you need as soon as your coverage starts.
Mhm. So hopefully y'all heard that. Like you can get your treatment for your coverage as soon, you can get your treatment as soon as your plan coverage starts, right? So another incentive to enroll in your health insurance coverage through the marketplace. So Deanne and Traylon, I mentioned earlier that there is a special enrollment period that's happening right now through the Affordable Care Act on the marketplace. So when it comes to mental health care through the marketplace, I'd love to hear what you all have to share or some thoughts that you have around marketplace plans covering mental health services, behavioral health services, and what does enrollment and eligibility look like for those who are interested in enrolling in any health insurance coverage during this special enrollment period? And what is a special enrollment period?
You go ahead, Deanna.
Okay, so with the special enrollment period, that means you meet a certain criteria or life-changing event that will allow you to enroll in a healthcare plan during any time of the year or outside of open enrollment. So right now, they do have the new special enrollment period that's for people who are below 150% of the federal poverty limit. And I know when we say FPL, federal poverty limit, that's very broad and some people don't understand that language. So if you are unsure if you fall with below that 150 or at it, please reach out to one of us, the Navigators, or go to your local health to get that assistance so we can screen you to see if you qualify for it. But with the plans on the marketplace, because they do cover mental health is a part of the essential benefits, you are allowed to get your behavioral health treatment. So if you need counseling for any service, you're allowed to get that. It's essential. You can get your mental health and behavioral health inpatient services. And that also goes for anyone who needs substance use, who is suffering from substance use disorder and needs treatment as well. Those are all covered under essential benefits. And also, as Traylon stated, if you are not happy with certain doctors and you want to look up a specific doctor, we can do that as well. If there's a doctor you know who's comfortable with helping you and it understands your culture, let us know if that's the doctor so we can look for a plan that that doctor may accept.
Yeah, so I like that. Like you can, research providers that really are specific to your needs and your wants, and that really reflect the cultural domain that this person exists. So that's, really, really good to know that you all provide that support there. And one additional note about the special enrollment period, Deanne, and I'll let you share this, but unfortunately, it's not available to people who are in the coverage gap, correct?
That is correct. So unfortunately, Georgia has not expanded Medicaid, and that the financial assistance programs with the marketplace are for people who meet a certain income limit. So for those who fall between that gap, this special enrollment would not be able to assist them, unfortunately.
Mm-hmm. So just another note there, because those folks are not eligible for any of those premium tax credit. And again, these are people who are not eligible to enroll or not eligible for Medicaid because they make too much money, but they don't make enough money to enroll in a health insurance plan through the marketplace. But we do have resources that we will discuss here in just a bit for those mental health resources for those who are uninsured as well as for those who are insured. So Deanne and Traylon, we're in a special enrollment period right now, and regular enrollment period will start for everyone when?
November 1st.
November 1st. Okay, so I know it seems like we're a little ways away from November 1st, but again, that's just something that you can go ahead and start putting on your radar now if you're interested in applying or enrolling in a plan through the health insurance marketplace. So back to some resources, Traylon and Deanne. I know that a few of these are going to pop up in the chat here in a bit, but I'd love for you all both to share. I'd start with you, Traylon, for resources, mental health resources for folks specific to the LGBTQ plus community, those who are uninsured, underinsured, or are insured, and they want access to more care. So What are some
Okay, yeah,
resources?
great. So some allies in care are specifically for those who are insured. Absolute Care, located in Buckhead, is an excellent ally for the community. They offer mental health resources and services there, and it is for insured, however. For those who are uninsured, you have you have Positive Impact Health Centers as well. And whether you are, well, they also take in individuals who are insured, but if you're not insured, you can also sign up for services and get some of the resources that are available through that specific organization. Also, for those who are insured or uninsured, St. Joseph Mercy Care is also a good resource to access when you're trying to get mental health services. And a couple of more that we'll definitely put in the chat. But those are definitely some to start with, and they are definitely also culturally sensitive and friendly to the community as well.
Okay. Okay, good. That's good to know. So hopefully you all are able to take advantage of those in the Facebook chat. And then Deanne, what are some that you would recommend folks reach out to for rural communities or those who are uninsured or underinsured for mental health care?
Now, in the rural communities, we don't have as many options as it is in the Metro Atlanta area. But for those who do not have health insurance, the two main organizations I work with would be I Hope Inc. And they're actually a recovery center, and they do not, they help those who are uninsured. So you don't have to have insurance to get the counseling or treatment with their program. And then I also work with the Macon Volunteer Clinic. They provide service if you need primary care assistance. And again, you don't have to have insurance. They have programs to assist you with the cost.
Okay, that's good to know. So again, hopefully you all are able to take advantage of those resources in the chat, share them with folks who may be wanting to know more about how to care for their mental health, but they might not have insurance. And they just want to, to schedule a consultation with someone or to kind of open up the door a little bit to learning more about how to take care of your mental health. And there are resources out there that are available, culturally sensitive resources, culturally appropriate, things like that. So, and lastly, Traylon and Deanne, how can folks contact you all in wanting to enroll in the special enrollment period or in preparation for open enrollment, which will start on November 15th. So please let the folks know how they can contact you.
Okay, so they're going to put my information in the chat. I, for some reason, cannot remember my phone number, and I'm looking for it now. That's crazy.
Okay.
But my email is tcooley@healthyfuturegA.org. TCOOLEY at healthyfuturegA.org. And we'll also put my number in the chat because I cannot find it right now.
It's fine. Like, it's totally fine. And we have, yes, this information is also on our website, but we don't want to miss the opportunity to let the folks know how they can contact you too. So
And
it's
right
fine.
quick, and just an additional or a side note, people ask all the time, why should I access mental health? I don't need anything. I'm okay. Mental health services are to help you navigate through life.
Yeah.
And sometimes any types of traumas that we experience, we sometimes need somebody to talk through those things with us. So whether it's a divorce, whether it's being a new parent for the first time, whether it's moving to a new city or state, there's so many things that could create anxiety within you that will cause you to become a recluse or just affect the way you think about things or navigate through your day. So we want to begin, as we're in the spirit of normalizing the conversation, um, setting the tone that we want people to be okay with being proactive with getting mental health services as opposed to being reactive. Just as we go through our day to day and we're managing, how we eat and we want to be healthy so we don't have to go to the doctor because things have occurred. Same thing with mental health. It's okay to talk with people about transitions that you're having in life so you can better understand how to deal with those things, or if you're thinking about those things in certain ways, just having someone to help you navigate through that conversation. And it's not for individuals only who have an intense need, but it is just something to help all of us continue to maintain our day-to-day. So I
Yeah.
want to make sure that we're putting that out. And because many people have a misconception of mental health services, that it's a reactive type of thing, and it's
Mhm.
a managing day-to-day type of thing, really, if you think about it.
Yeah, I like that point. Like, it's not something that you have to be in a crisis mode to seek out.
Crisis, yes, that's the word I was looking for.
Yeah, you can access mental health care as much as you need it. So, Deanne, if anyone has questions for you about insurance enrollment in Macon area or any of those surrounding counties, how can they contact you?
Hey, and again, you can contact me about your health insurance. Don't let Trayland make you think we help with counseling. But we
Yes.
can be a counselor, okay? You can reach me at, my direct contact number would be 404-772-0223, or you can email me at dwilliams@healthyfuture.org.
Okay. Yes, great point. Great flag. Contact Traylon and Deanne about wanting to know more about your health insurance coverage and enrolling in coverage. And anything related to your mental health care, do reach out to a mental health specialist provider. So something that Traylon mentioned earlier, and we've kind of, it's made its way into our conversation, but we want to shift and talk a little bit more about parity. And, Traylon said earlier that we need to be ensuring that we're taking care of our mental health, just like we're taking care of our physical health. So I want to shift the conversation a little bit to talking about mental health parity, defining parity, how that shows up in any marketplace enrollment plans, and what does GHF, this organization, what is our role in ensuring that healthcare providers or providers in Georgia are implementing parity in all of their provider plans? So, Deanne, I'm going to shift it over to you a little bit. And knowing that Georgians for Healthy Future, GHF, has been an advocate for parity for many, many years. Prior to the Mental Health Parity Act that was introduced and signed during the 2022 legislative session. We know this will significantly help Georgia because Georgia is ranked 48th when it comes to mental health care. So when enrolling in any marketplace plans, Deanna, can you first define what parity is and why it's an important factor in marketplace coverage?
Okay. So when it comes to parity, parity just means that we're going to treat mental health conditions and substance use disorders the same as we would as a physical condition with our insurance plans. And when we say mental health, we do both mean mental health and substance use disorder. And parity is very important when it comes to your insurance because without parity, individuals and families are more likely to delay getting the mental health services they need. They may go outside of their insurance network because they're not sure if their doctor will give them a referral or that they'll get the help they need by going to their primary doctor. Or they may end up paying more for behavioral health services when it's actually covered with their insurance.
Mhm.
So that's why you have to make sure you follow that process. Speak with your doctor. If you feel like your doctor is not listening, call your insurance to see where can you get those services and what provider can give you those services. Speaking with providers, if you're not comfortable with them, they may not be listening or they may just don't want to listen. So you may have to go another route.
So, Dan, if consumers feel like their health insurance plan is not following parity. So as a reminder, like Deanne said, parity means that mental health conditions and substance use disorders should be covered the same as any physical health condition in insurance plans. So if consumers feel like those examples that you shared, so they're having to maybe pay higher costs or they're being limited to fewer visits, for the mental health coverage, but not for other types of healthcare. And then if they feel like they're having to pay higher out-of-pocket costs or higher costs for any medication associated with their mental health care or their mental health treatment, what should consumers do if they believe that their health insurance plan is not following parity?
If they're not following Parity, you need to ask your plan for more information. There is an option when we look for your plans on the marketplace to see what behavioral health benefits are covered. So you can ask your plan, what behavioral health benefits or mental health benefits can I receive? What's covered under my plan? What are my policies to go to them? Do I need a referral? Because there are certain steps and insurance can be very difficult to understand. And you may not know I need a referral because I'm in an HMO plan. It's okay. That's why you call them or you call your doctor or you call a navigator. And we can assist with helping you with those steps. If for some reason you receive mental health services and they're denied or they deny or refuse to pay it, they need to provide a reason why it was denied. Whether they say it required a prior authorization or prior approval, they need to provide that reason so you'll know to get that coverage that you need or those services. What's the step I got to take? Because I pay for insurance. So if I can get it covered, I want it covered. And then just speaking up, don't feel silenced. Don't feel like your voice is not heard. Your mental health is just as important. If you feel like you're not getting the medication you need, if you need medication for blood pressure and they pay for it, then if it's something for your mental health, it should be just the same. Yeah. It's equally important.
Yeah. And if folks, you're asking those questions, you feel like Parity isn't being followed, asking more information about your plan, the reason for any denial of payment for treatment. And then you can also contact the Department of your insurance commissioner here in Georgia, right? If you feel the need to take that step to file a complaint, correct?
Yes.
Okay, so that's good. That's helpful. Again, GHF has been advocating for parity since 2017. So this is not new work to this organization. It is great to see the landmark Mental Health Parity Act signed this past legislative session, and we look forward to whenever that implementation will take place, so that folks can have more access to mental health coverage. And the hope is that Georgia's healthcare ranking in mental health will go up. Because more folks will have access to treatment for mental health and substance use. So going to switch gears a little bit because Traylon has mentioned throughout this conversation that we really need to make sure we're normalizing mental health conversations as much as we are in the communities that we are in our networks, in the Georgia community, and the work that we do. And again, acknowledging that it is Asian American and Pacific Islander, Heritage Month. It is great to have Camila Gomez and Tom Liu on this live conversation today, just to lift up this mental health conversation in their communities as advocates, as practitioners, things like that, mental health practitioners, behavioral health. So I am going to allow Camila and Tom to quickly introduce themselves before we get into some questions for the both of them. So I'll start with you, Camila.
You're muted.
You're muted.
Sorry about that.
Okay.
Hi. Thank you, Kanetta, for the introduction. My name is Camila Gomez. I'm a health program coordinator at CPACS. I work with local youth and school systems to educate and provide resources for engagement and learning opportunities. We provide after-school programs to bolster their social and emotional capabilities to resist peer pressure and know the facts about drug use. We work to cultivate an environment with local teams that is open and non-judgmental so they can feel safe enough to be vulnerable in order to explore what's going on socially, academically, and with their families. So we hope to provide them skills to be able to rise up against any challenge. And that is my introduction. I'll pass the microphone over to you, Tom.
Hi, my name is Tom Liu. I am a psychotherapist, licensed clinical social worker in Georgia and California. I have my own private practice called DL Wellness LLC, where I help folks 16 and up deal with anxiety and depression, PTSD symptoms. I think that's it. I'm Asian American, specifically Chinese American. I came to this country not knowing a word of English, so the immigrant experience is very much my own, and I want to give back as much as possible. That's why I'm here.
Thank you so much. We're so glad that you all are able to join. So I'll start with this question. Either of you are welcome to take it, but GHF does recognize that it is Asian American and Pacific Islander Heritage Month. And we know that this encompasses a wide range of identities, nationalities, ethnicities, countries. So I would love to hear if one of you could share more about why this conversation is so important in the Asian American community. And what are some of the attitudes about mental health in the Asian American community?
I can begin, and then I'll pass the microphone over to you, Tom. So working here in Doraville, it's a very diverse community, and I think that access to resources is a huge issue, and that now more than ever, it's more important to elevate this conversation. I believe that there's themes of trauma, abuse, and manipulation stemming from colonial and imperial roots that these communities bear now. The fact is, suicide is the leading cause of death among Asian Americans ages 15 to 24. But most would never guess this due to mainstream representations, which portray Asian American and Pacific Islander groups as model minorities in wealth, health, and mannerisms. So I definitely think that more can be done, and I'll let Tom move forward with what he thinks he could provide.
Yeah, absolutely. That was like a really good segue into what I was going to say too. There's about 16 million Asian Americans in this country, about 5% of the US population. But most people don't know that nearly 1 out of 4 Asian American Pacific Islanders is limited English proficiency, and their households are limited English proficiency. So that means that the children who grow up in English speaking schools become the parents of the family, and they start contributing at a much earlier age and take on additional responsibility. We call that the parentified child. And so the stress, the anxiety associated with that is much greater than the average population. And this is across the board in a lot of immigrant populations.
Yeah.
I think specifically for the Asian community, just like Camila said, this idea of you can only be doctors, lawyers, and engineers is pretty prevalent. And it becomes actually a big problem because in a 2018 study, they found that the top environmental conditions harming adolescent wellness, among them were poverty, trauma, discrimination, and excessive pressure to excel.
Wow.
That is an actual, precondition to having less mental wellness. If you look at Ivy League schools, 30% have mental health problems.
Yeah.
And that's a big issue.
And the pressure to excel, right? Like pressure to excel, poverty, trauma, and what was the fourth one?
Discrimination.
Discrimination, right? So, Camila introduced us into some of the stigmas and prejudices that exist in Asian American community, and feeling like you have to have a well put together lifestyle, you have to that model minority and mannerisms and things like that, and leading in wealth and education. So, from your experiences or the experiences of those that you may work with, how does taking care of your mental health help eliminate some of those stigmas? Like, how does that show up, knowing that, knowing the statistics and, reviewing the reports, like how is it super important to take care of your mental health so that you don't find yourself, falling into one of those categories or becoming one of those statistics? Like, how can you recognize that taking care of your mental health ahead of time help you from being a part of one of those statistics or experience or those issues impacting your mental health? Does that make sense?
Yeah, I can go first on this. I imagine mental health almost as similar to physical health. So in physical health, there's 3 kind of requirements to gaining physical health, right? So first is exercise, the second is nutrition, and the third is rest. That is basically the only ways to gain muscle. And for me, emotional health is very similar. To me, this is depression, constantly lax, kind of there's no muscle tone. There's like very little affect, right? This is anxiety. You're always tight. Everything's tight in the body and you're always restricted. And to me, mental health work with a therapist feels like this. It's a
Wow.
movement between the two so that you can get emotionally stronger.
Wow, I love that, Tom. I love that. I love that analogy. That's super, super helpful. Just, not eliminating that you might not fall into one of the categories at any point in your life, but you're doing the work to kind of flex that muscle a little bit more, so that you're becoming mentally stronger. I really like that. Thank you for sharing. That's super helpful. What about you, Camilla?
Yeah, well, firstly, I think that the biggest step is just accepting that, you want to prioritize yourself. I think that many groups, and as a woman myself, you kind of want to put everyone else before you, and you want to help others and nurture others and uplift the community. But definitely prioritizing yourself and taking that first step is important. And then I do believe that practicing mental health either through connecting with nature, you can also do it in other various ways, like having a buddy, going for a walk, and getting connected with each other. I think that being united in community is a wonderful way to harness this feeling of love and acceptance that I think we all pray for, and that sometimes as a minority group, you may feel isolated, especially during these times during COVID, where a lot of AAPI groups may have felt targeted, and maybe they feel more alone than ever. So definitely coming together as a community is, I think, a good way to help your mental health now.
Yeah, and a lot of this, what we've talked about in this conversation really is rooted in, community care, like that community system of care. So, taking care of your mental health, and, just as you're taking care of your nutrition and your physical health and, all those other parts of the body, reaching out and getting getting health care insurance, that requires like a community of people, like reaching out and getting access to resources that are culturally sensitive. Like that requires being a part of a community of people, and having allies. And so I think that we can make our mental health much stronger if we approach it from that community system of care. So I like that, Camilla, a lot. And I just actually pulled up our live, and it looks like there's a question in here, and this might go back to Traylon or Deanne one, and we may have addressed it already, but I want to lift it up. The question is, how do you deal with a doctor dismissing a patient from the entire group for no other reason than the patient has a rare condition, and the doctor refuses to give a reason? So Deanne or Traylon, because we did talk a little bit about parity, what is the suggested response or plan of action if a consumer sees that happening? Their healthcare provider dismissed the patient for no other reason other than they have a rare health condition, and they refuse to give any other reason. So do you all have any feedback for that question?
Well, initially, that could be a tough one, but it's a relationship. So it's a reciprocal relationship. You always want to be somewhere where you feel acknowledged, where you feel safe, where you feel heard and helped. So I would definitely encourage an individual to uh, find a practice or provider that you get that from. In this instance where you've been dismissed from the group, and if you have an affinity to stay within that practice, it would be good to possibly seek out other providers within the group, hopefully where you could switch to someone where you have a better relationship with. There are also There are also, what's the word I'm looking for? An appeal process that you could possibly go through. Just highlighting your experience, or I should say appeal, I'll say complaint, to highlight your experience with your provider, to sort of get that knowledge out there, how they are navigating through services with consumers, so that can be flagged and maybe addressed on a higher level. But I would definitely encourage someone to get with a provider they feel comfortable and safe with, felt and heard, and then just contact the marketplace and talk about those concerns and what better feedback the marketplace could give you in that instance.
Yeah, that's helpful. And also, you know, like you're saying, Traylon, documenting that type of care, that refusal of treatment or refusal of care too. So if they do choose to follow with any sort of filing a complaint or anything like that, then they will have documentation to help back up some of that. So I wanted to lift that question up before we came to a close. But before we do that, Camila and Tom, I know that you all talked about some resources for the AAPI community. And I'd love for you all to lift those up so that we can make sure that our viewers are aware of them and know how to get access to that to that mental health treatment.
Yes, so first I'll just share some of the activities that CPACS has been doing this month to celebrate Asian Heritage Month. And first off was Cultivating Kapwa, which was at Gwinnett Tech. And it was celebrating Filipino American culture. Students from Georgia State, Kennesaw, UGA, and North Gwinnett High School were able to come together and join with their student-run organizations in order to talk about themes of how they're celebrating their history, going over any issues that they've been having culturally growing up in this in the States as second-generation immigrants. So I just urge everyone to connect with their schools and see if they'd be able to start a culture club if there's not one already there. So you can begin to cultivate that community. And during Cultivating Kapwa, they are going to be creating a web of Filipino American student-run organizations across the state. So if anyone would needs any information with how to start a culture club, or if they want to get connected with other ones in other universities, please contact me, Camila.Gomez at cpacs.org, and I'd be happy to help you get connected with someone or a mentor that can help you get started.
Awesome. Thank you so much, Camila. I love that, starting a culture club at your school.
Yeah.
That's such a good idea. Tom,
And much needed.
Yeah, and so much needed, right? Tom, did you have any resources you'd like to share?
Yeah, absolutely. I'm going to type it into the chat here. So the first link is a link where you can actually apply to get free therapy with me. Asian American Resource Center Atlanta has a fund, and they can use it to apply for Mandarin speaking and Korean speaking therapists. So you can go to that website and apply for that fund. The second resource, Asian Mental Health Collective, is a great online resource specifically for Asian Americans teens, I think. They have a Facebook group that I think about maybe 12,000 strong, actually, that talks about mental health. And they have a fund too. They have a Lotus fund. I think they contribute about 25,000 a year into that for free therapy for therapists that kind of go along with that fund. But it comes out like quarterly, I think, and you have to follow them on Instagram. And I think that's, for them to get more followers, but also, I don't know where else it comes out except for Instagram. I think raksha.org is a great resource for immigrants that have been through violence and domestic violence, abuse, trafficking, and whatnot. And lastly, the Asian Mental Health Professionals of Georgia is a place where you can look at Asian providers in Georgia.
Okay, that's good. This is also good and helpful, and I believe that it's also in pinned in the chat on Facebook too. So hopefully everyone is able to take advantage of these great resources, some free resources or free to low cost, and really begin to like as Tom was saying, like flex that arm. So we're building more emotional capacity to take care of our mental health in the best way. So
My
go ahead.
apologies. Yes, I just wanted to also mention the link to the book resources. So I'll also drop that if it's not pinned. And these are just 6 books written by Asian Americans. And in this difficult hour, it may be inspiring to hear how others in the community have persevered. So these are also written by LGBTQIA Asian Americans. And they're delving into stories about mental health. If you guys would like to start reading something like that, I think that could also be useful.
Yeah, some good summer readings that's coming up, right? Since we're almost going to be in the summer. So thanks for sharing those, Camila. Okay, so as we come to a close, I did just want to share a couple things before we end. Do take advantage of this special enrollment period that is currently going on. If you are shopping around for health insurance coverage and you need coverage and you're interested in enrolling through the marketplace, please contact Traylon or Deanne and they can help you, educate you about that process and help get you enrolled and answer any questions that you might have about that. Do continue to stay connected with GHF through of course, our Facebook page for those of you who are still watching, and also through our website. There is always an opportunity to connect with us and share your healthcare story. So if you are a Georgia consumer and you are insured or you're uninsured, or you're in the Medicaid coverage gap and you want to speak out a little bit more about that experience, about your experience, please connect with us through our website. We do have a story collection tab there where you can share your healthcare story, and someone will be back in contact with you because again, we do value the consumer voice in the work that we're doing. All of us value the voice, the consumer voice that are joining in on the conversation today. And lastly, normalize the conversation about mental health. So we want to get to the place to where, if you're having a not so great day, then you can communicate that, and you have an allies, that community care around you that kind of knows what to do and step into action if you need additional encouragement or support. But really normalizing this conversation, not just when Mental Health Month ends, but every month, right? We want to make sure that we're creating safe accountability spaces where we are talking about our mental health openly, and there's resources available to connect folks, culturally appropriate ones and culturally sensitive ones. So that wraps up today's conversation, today's Facebook Live. Do tune in for more. GHF will be hosting in the future. Again, thank you, Traylon, Deanne, Camila, and Tom for your time this afternoon. Greatly appreciated. And we do hope that everyone takes great care of themselves, and we look forward to talking to you again soon. Take care. Bye-bye.
Bye.